The Special Economic Zone is where all arriving COVID-19 vaccines are stored before being dispatched to health facilities across the country for vaccination program. The Minister of Health, Dr. Daniel Ngamije, accompanied by officials from the World Health Organization, are visiting the facility to understand how COVID-19 vaccines are stored and transported to health facilities across the country. A new phase of vaccination began this week with a focus on people aged 65 and above. Despite the ongoing vaccination campaign, recipients of the jabs are being educated about the need to continue adhering to set health guidelines, at least until everyone is inoculated. I know that even one who is vaccinated may be infected or infect others who are not yet vaccinated. I'm going to continue practicing precautionary measures, such as wearing face masks properly. I'm very happy because health professionals came to remind us of the importance of continuing to observe precautionary measures to make sure that I don't infect other people. Masaka Hospital Director Dr. Halindifura Jean Damascene says the vaccination program is going on well. There are no issues so far. The public is being educated about SOPs and the response has been good. Minister of Health points out that in the past 2 days it's been observed that the number of COVID-19 infections have risen again. Earlier this month, there were more than 50 people, but Tuesday's figures confirmed that 127 new infections and 4 coronavirus deaths were registered in the country. The Minister of Health, Dr. Daniel Ngamije, explains the reason for this increase in new infections. I think the numbers that seem to be going up are largely due to the increased screening, but also in the recent days we tested many people who crossed into the country from the neighboring DR Congo, and that the fact that some activities were allowed to resume operations in order to boost the economy, it could be as a result of the increase. The cases are still low, but we keep a close eye on it. There's a limit we need to know. If we get more than 100 people every day for several consecutive days, it means there is a problem. On Monday this week, Rwanda Biomedical Center launched another drive and walk through COVID-19 street testing survey in Kigali. In 5 days, 2,000 samples will be collected in Kigali and its suburbs. The survey will help health authorities understand the prevalence of the pandemic and inform response efforts. Minister Ngamije says people should continue to abide by the set health guidelines, stating that the pandemic continues to claim lives. We are closely monitoring the situation to find out how much capacity we have in hospitals to take care of the sick people should the cases continue to increase. We've come here to see how the vaccination program is going because we feel vaccination is a lasting cure. What we are asking the people, especially those that we are vaccinating, is to feel comfortable with the jobs. People have to keep in mind that the pandemic is not going away because we have not even reached 10% of the people who should be vaccinated. So people should be patient, at least until we've vaccinated up to 50% of those we need to vaccinate. Until then, we can come up with the new resolutions that will be less costly to keep life going. Dr. Topista John Kabuteni from the World Health Organization praised the way Rwanda is behaving in the fight against COVID-19.
As we are here now to look at the progress on the vaccination, we really commend the work and the good work which is continuing to be provided through the Minister of Health and the other partners. And really, Rwanda is a role model to other member states.
According to figures from the Ministry of Health, more than 375,000 people have been vaccinated since March with the Pfizer and AstraZeneca vaccines. By the end of this year, Rwanda plans to receive another 3,500,000 Pfizer vaccines. The country plans to vaccinate at least 7.8 million people, or 60% of the population by 2022. Reporting for RwandaTV News, Ethan Tashobia.